All right, thank you so much for tuning in. Dr. Kehinde Elisha speaking here, founder and CEO of FNP Certification Academy. Today, we're going to be going through some NCLEX test taking strategy and pharmacology, not psychopharm. That's a mistake. I guess I'm too addicted to psych. That's why I put psychopharm. It's just a general farm. So now, when we talk about NCLEX, first of all, what should you keep at the back of your mind? How should you be thinking on the exam? You cannot think anything outside of something that we call the ADPI process. What is ADPI process? ADPI process is nursing process. And what is nursing process? Nursing process is critical thinking. Nursing process is critical thinking. So now, let's talk about the A. Let's talk about the D. Let's talk about the P. And let's talk about the I. So what is nursing process then? It is a systematic way in which we approach our patients, in which we take care of our patients. That is a systematic way. ADPI process can be applied to any subject and any area of our lives. Particularly this exam, you have to apply it to it. So now, how does it play out? How are you supposed to apply it to the exam? So now, first is, what is A? A means what? Assessment. And if you know it, you can start typing it in the chat too. And you're like, you know what? I'm tired of hearing of the ADPI. Well, maybe you're tired of passing then. That's what you're saying. Because you got to know this really well. And you won't see me, I won't shut up about it, okay? Until you leave my class. So assessment is A. The D is what? Is diagnosis. Now, the P is what? The P is a plan. The I is what? The I is implementation. Okay. Now the E is what? E, to evaluate. Sorry, I'm writing with a keyboard, so it's just going wherever it wants to go. But anyway, assessment, diagnosis, planning, implementation, and evaluation. What is the implication of this? Okay, I am gonna create a presentation on how and why this is so important to us as a nurse and as healthcare workers, period. So A, D, P, I, and E. Okay. So now, what is the relevance of assessment? For example, you have a patient with, I don't know, liver failure. If you assess that patient well, it is great. You will be happy and the patient will be happy too, because why? The NANDA, because you may be thinking too, well, I don't diagnose. It's okay if you don't diagnose, but we do have nursing diagnosis too. Your NANDA will be right on point. If your NANDA is right on point, your plan is going to be good. If your plan is good and it syncs with your assessment, guess what? Definitely your implementation will be, boom, great as well. And eventually you go back and check, patient is going to be alive and smiling from neck to neck. Now, the opposite can also happen. When we have a patient that we did not assess really well, guess what? That's a big problem right there. The diagnosis of plan is going to be in shambles. Implementation, forget it. That's even the patient makes it there. They're probably dead already. I'm just saying. So I'm saying right now, assessment is everything. Assessment is everything. Understanding your assessment is the core of this exam. It's going to help you pick up on what is emergent, what is urgent, or what you can just pretty much call the doctor for, what you should call a code for. It is your assessment skills that will help you with that. Now, allow me to expand on assessment. Because we have 14 body systems, assessment plays a significant role on all those 14 body systems. And you're like, oh, okay. So for example now, you have a patient we have 14 body system. Let us pick cardiovascular disease. When you now pick cardiovascular, that is a system, by the way. When you now pick cardiovascular system, you will now think of, okay, what disease do we have under cardiovascular system? Can you drop a couple of cardiovascular system disorders in the chat? Give me 2 examples of cardiovascular system that you can think of. Heart failure, okay? CVA, not really, but I see the connection. MI, okay, I see PAD, that would be accurate. So now let's go ahead and pick CHF as one of the patho, okay? As a nurse, you have to do what? You have to understand a minimum of at least 10 patho under each body system. And you not only have to understand the patho under each body system, you also have to understand the heart pipe process. So now we have cardiovascular system. We have heart failure plus 9 other pathos that we have to know. That's cardiovascular system alone. So whenever you say you study, you got to take stock of what you're studying. Are you hitting all the 9 yards? Are you connecting the dots like you should? Are you able to see the 10? Are you able to remember and recall the assessment of certain patho under cardiac? Just don't say you study cardiac and all you study is CHF. You have 9 more pathos to worry about under one body system alone. So now, if you have ever taken NCLEX before and you didn't pass, you're not stupid. You're just missing out some meat, right? But you feel like you study because what you study is still a lot. It's just not enough. It is not strategy that gets you through this test. It is content. There are no strategies without content. Absolutely none. So now when we talk about cardiovascular system, we're talking about CHF. So now, let me get back on track. CHF. How do we assess a patient with CHF? That is your A. What is going to be my NANDA diagnosis for somebody with CHF? That is my D. How do I plan for a patient with CHF? That is my P. How do I implement? How do I carry out? How do I intervene for a patient with CHF? That would be my I. Or at the end, what is going to be my evaluation for somebody with CHF? Are we supposed to refer the patient? Can we handle the patient in an outpatient setting? Or we need to send the patient to the ED? That is not your job. That's your role as a nurse. You have to know exactly what move they're going to make next. That's why on NCLEX exam, they will say you are giving this medication. What is the likely side effect? Listen, you're not the one ordering that med. Listen, you're not the one ordering that medication, but you are the one giving it. So you have to anticipate before you give it. This is why some nurses are in jail, because you are that last person. You are the UPS. You are the last person to bring that package to my house. So you better don't bring a bomb. You know what I mean? You can't bring a bomb. If you bring a bomb to my house because some doctor gave it to you to put it at my door, and my house, boom, get blown off because of the bomb, it's your fault. You get my point now? The same thing happens here. Order is being written, but now you didn't take time to assess and see if you can really give that medication or not, if they have some kind of issues or not that the doctor missed, and you just slap the medication on the patient's body. It's your fault. Listen, I'm talking about I right now, but I have applied that to CHF, how you have to see things differently. How do we assess our patient? How do we diagnose? How do we formulate NANDA? And listen, we're going to be talking about nursing process. By the time we get through my foundation this week, we're going to start integrating nursing process to every patho so you can see how things connect. The ability to connect the dot will take you to the top. Listen, there is no house that is built on a sand that will stand. A house must be built on a solid rock, period. Dr. Kehinde Elisha speaking here, CEO and founder of NP Certification Academy. To reach us, nurse-to-nursecoach@gmail.com or visit www.npcertificationacademy.com. So listen, we have now talked about CHF. Somebody mentioned PVD. So let's say the second patho is PVD. What do we do here then? We want to assess. How do we assess a patient with PVD? How do we diagnose a patient with PVD? What is the plan? What is the implementation? What is the evaluation? Now, what I want to quickly talk about now is the I. Underneath the I, a lot goes into it. When we are giving a particular medication to a patient, are we watching them for side effect? Are we watching any kind of interaction? Did we review their charts to see whether they can get it or not? Is somebody have asthma and we're not supposed to give a beta blocker, but the doctor ordered a beta blocker anyway and went ahead and just dump it in the patient? It's your fault. Listen, you should have looked at the chart. Yeah, they should have looked at the chart before they order the med, but you will be the one to take it to my address. You're supposed to check and see if you're taking it to the right address or not. You miss my address, it's your fault. That is what's going on here. Or you bring a bomb to my address and kill me, it's your fault, not the doctor, because the doctor's probably somewhere sleeping. So we have to put all of this together, and we have to make sure we are operating within what our scope of nursing practice. We have to pay full attention. Remove the fact that you are passing NCLEX, you're doing NCLEX just to take exam. You got to start seeing NCLEX as a patient. If I score is 0 out of 100, I kill 100 patient. If I score 80 out of 100, at least I save 80 patient, but I kill 20. It's still better. So they are still fair enough to say, okay, you don't have to get 100%. You don't have to save every life, but you have to have the ability to save some life. Now let's go ahead and move on to some of the test taking strategies. If you have any questions, please make sure you drop it in the chat. And I'll be posting this content to get on that. Now listen. So what are the strategies tonight? You got to understand what the new question format. Let me tell you right now. We have an exam format called the NGN. The NGN should not be your headache. It is just a regular question. Just a thicker case study, 5 to 6 line long, with like 6 to 10 questions underneath it. That means what? You got to understand the case study. And we did some case study, was it last week? Just to kind of introduce you to how case study looks and how it works. We're still going to do some case study tonight. The most important thing is not about you memorizing case studies. It is you understanding how to approach case studies. Listen, if you do 5 to 7 case studies, you will still pass this test. The secret to passing NCLEX is not studying 1,000 questions. That is what most people do, but it's a wrong technique. Listen, if you have 100% of your time, if you have, let me say 100% time, you want to study your content 80% and do questions 20%. I promise you will still pass. Because when you have a content, a good content and you are solidify it, you can potentially answer up to 100 questions with that one content. But if you memorize 1,000 questions and you do it over and over, don't get me wrong, I'm not saying questions are bad, but it's a wrong approach to put all your eggs in that basket. It's not a good place to put all your eggs. If you practice 1,000 questions, you may never see more than 10. And it's never going to be word for word. Nobody, including me, have NCLEX questions. So put your mind out of that. Again, let us be ethical. We are going into a profession where ethics is extremely important. Stop looking for questions, start looking for strategies. Stop looking for questions, start looking for content. Content is the meat of all of this. However, strategy is also a good icing on the cake. You know, that fluffy part of the cake is the most beautiful piece to eat. If you can have that part, it's okay. And then you will now glaze it with a little bit of strategy. That's okay too. But don't think strategy is everything, because it's not. So now you got to understand what the new question format. NGN they introduced a new one, extended multiple choice response, drag and drop. This format, you must also be very, at least be familiar with it before you get into the test. So it's not a waste of time to understand what these test questions actually look like. And I know we did some of that last week, and we also have it in Canvas. And I'm going to be guiding you through more of those. So use NCLEX RM plans and blueprint, review NCLEX test plan, which provides the breakdown. I always I know I got you all tired with my breakdown. You can't lose sight of a blueprint. Let me tell you what a blueprint is. Blueprint is a map. Blueprint is a GPS. You don't have a GPS, you're lost, period. Blueprint is, I am the one writing the exam. This is going to be on my exam. These are the sample questions of my exam. What else do you want from them? Nothing more. So you're going to knock this exam out, because now you are in the right place. You know exactly what the blueprint is. You know, you're under our guide, and you're going to be okay. Safe and effective environment, health promotion and maintenance, psychosocial integrity, physiological integrity, and so on and so forth. Practice clinical judgment. The NCLEX NGN focuses on clinical judgment. So practice questions that assess your ability to make safe and effective decisions. You want to use tools like clinical judgment model, nursing process like assessment, diagnosis, planning, just what we just did. Develop test taking strategies. Eliminate obviously wrong answers. How will you know what is wrong without content? Every answer will look wrong if you don't have your content. No strategies without content. You want to use POE. How in the world do you know what to eliminate if you don't know what to eliminate? See my point now? We can only tap what is up here. What we keep in here is what we can take out from. You got to get into the habit of committing a whole lot to your memory. Focus on the most or first. When a question asks about the first action or the most important intervention, you got to think about what you'd do immediately to save your life or prevent further harm. You want to simulate real test-taking conditions. Take full-length practice exams, just like we have in Canvas, and then thoroughly, listen, don't skip that part, thoroughly, in details, review the rationale for all correct and incorrect answers. Thoroughly review the rationales. Focus on prioritization. You gotta know who to delegate to. Don't be asking a CNA to teach. They don't have the education to teach. Now, it's okay for a CNA to reinforce your education as an LPN or as an RN, but you don't tell them to do the original teaching. Pay attention to that. A CNA is a nurse. They call them they don't use nursing assistant on the exam. I can't think of what we call them. There's a professional name for CNAs, nursing assistant. Don't worry, when it comes, I'll let you know. UAP, unlicensed assistant personnel. That's what they are referring to as nursing assistant, unlicensed. So don't be reading your unlicensed for licensed. So you got to make sure that you are not delegating some crazy task to them that is beyond their scope. Scope of nursing practice is extremely important. As an LPN, you got to stay within your scope. As an RN, you stay within your scope. Now, stay updated with evidence-based practices. Of course, stay up to date, and that's what we are here. That's why we are here to put you through that. You know, you want to be able to understand the guidelines that support medication, management, infection control, nursing intervention, and so on and so forth. You want to work on time management. It is a computer adaptive test that can vary from 75 to 145. Spend your time wisely, 1 to 2 minutes. If you're spending 1 minute on a question and you still don't know it, flag it and keep it moving, but make sure you pick something though, just in case you cannot come back to that question. Now you want to review pharmacology. It's not a choice. Listen, pharmacology falls under nursing process letter high. You got to know your drug-drug interaction, the food-drug interaction, the drug-disease interaction, and the population-based medications that we give, and who should we not give a beta blocker to? Why should we not give a beta blocker to somebody with asthma? For example, it's going to cause bronchospasm. Why should we worry about, a patient taking carbamazepine, Asian patient taking carbamazepine? Why should we worry about them? We need to worry about them because they may get Steven Johnson's rash. You got to understand some basic stuff like this, or somebody taking, maybe clozapine. Why do we need to worry about, agranulocytosis? We have to worry about agranulocytosis because we're talking about something about life or death right there. Their WBCs out is so low that nothing can really protect them. So we need to keep eye on all of that. It's knowledge that will help us understand and connect with all of this. Do you know other kind of emergencies? Do you know when somebody's in sepsis? Do you understand when somebody has a blood reaction to blood transfusion? These are basic knowledge that is expected. Okay, so hypertension, diabetes, cardiac diseases, pain management, these are things that are frequently tested. Self-care during preparation. Take regular breaks while studying to prevent any kind of burnout. You can't just keep going and going and going. I have extra strategies here. Practice with time questions. I kind of mentioned that. Master key concept. Eliminate wrong answers really quickly. Again, how do you eliminate wrong answers? You can only eliminate wrong answers if you have the content. Now, overthinking must be avoided. Use POE efficiently answer prioritization and delegation of questions efficiently. Again, we went over all of this. This is a repeat. Okay, so now this is also a repeat. We also went through this already. I don't know why I have it all doubled up. Nursing process, I went over it with my own schematic little diagram, but this is the content to back up what I was saying. A, assessment. D, diagnosis. P, planning and implementation. Assessment, you want to gather all necessary information. What is the history of the patient? What is the lab result? So you got to know what falls under what. Yes, we know what ADPA is, but do you know what goes under each of them? Do you know what we do under assessment? Do you know what we do under diagnosis? Under diagnosis, we're trying to analyze data to establish or to analyze or to determine the main concern or the main problem. This process will follow you up to advanced level, trust me. Now, planning, you want to prioritize now. Did they come in with a headache and they had a GI disturbance 2 months ago? The headache is the main problem right now, so that's the main thing we're going to focus on. How do we now implement? Implementation goes into different facets. What age group are we talking about? Is it maternity? Is it geriatric? Is it pediatrics? We're going to be intervening in a different way. How do we delegate tasks? Are we delegating appropriately? What are the best interventions for the population that you're taking care of? Whether the doctor or the NP gets it right or not, you got to get it right. And it's your knowledge that will help you pick up whatever mistakes they made because you are the last person that is going to deliver to this patient. You better don't be delivering an atomic bomb. You know what I mean? You got to deliver what is right. And that is where your job comes in. That is where knowledge comes in place. Now, what about evaluation? Assess the effectiveness of the intervention and adjust if necessary. Ask the right questions. What is the most important information here? Why is this happening, and what are the contributing factors? What are the potential risk or complications? What are my opinions, and which one is best situation? What evidence supports the decision, and what is and is it relatable? Those are the things that we have to look at. Now, consider all relevant data. When making a decision, take into action all available information. This includes what physical symptoms, lab and diagnostic results, patient history, current medications and treatments, cultural and personal factors that might influence care. Evaluate if any data is missing or unclear, and ensure that you're not overlooking any kind of important detail. You want to identify assumptions or biases. Be mindful. Any assumptions you may be making, be very, very mindful, because if you're so biased and you put all your own thoughts and your own lifestyle and your own opinions on that patient, you may not be able to come up with the right conclusion. You may come up with a faulty, something that is totally off, and it may lead to patients' death, or patients may not have a good outcome. Use clinical judgment models, Roy adaptation model. You got all these nursing theories that you don't like, they're all going to come to play. We're talking about Maslow's hierarchy of needs as well. It's also important. When we talk about safety being prioritized, Maslow falls right into that. Nobody that is sick will be thinking about becoming a president. You have to be in good health, and then you have food to eat, and then you have achieved everything in life, and you feel like, now I'm ready to go to the top. That is what Maslow is all about. Who is Abraham Maslow? Maslow says his theory is based on the fact that human wants, in fact, are insatiable. If human wants are insatiable, what does that mean then? That means that in life, no matter how much we have, we're never satisfied. We will always want more, and more. Initially, we were hungry. We were able to make $100 a month, and we're still able to feed ourselves with that $100. Suddenly, the $100 is not enough. Now we want $1,000. Now we have $1 million. Now we have $1 billion. Now, I got all the money in the world. I got to step it up, like Elon Musk. Now I want to be in the White House too, making the biggest and the fattest decision, okay? Because now I got all the money, I got everything. I want to have power and add power to it. That is what Maslow talks about. But in science or in nursing, we don't worry about self-actualization. We focus more on physiological needs. And that is also going to be our own needs as nurses. On exam, if you have to think aloud, do so. Think aloud and write down so you can make a connection between what you're saying. But you must have practiced all of this before you go into that pressure, though. Examination hall is a war zone. You don't want to go there without preparation. Evaluate the outcomes. After making decisions or interventions, evaluate the result. Ask, did the intervention achieve the desired outcome? What went well and what didn't? What could have been done differently? Reflecting on the outcomes will help you adjust and move and improve future decision making. Use simulation and case studies. Engage in simulation exercises and case studies that mirror real-life clinical situations. These help you practice evaluating clinical scenarios, analyzing patient data, making clinical decisions. Case studies also provide you with what opportunities to see the consequences of different decisions, helping you develop better judgment skills. So practice reflective thinking. Reflective thinking involves what? Reviewing situations after they happen and considering what you learned, what went well and what didn't, especially during the code. When we do have a code, usually we'll now return to the desk and start reflecting on what happened. Is there anything we could have done right differently that would have saved the patient's situation? Even if the patient is dying in the hospital, we still go all the way after them. It's human life. So we do our very, very best to make sure that everyone is well taken care of. Collaborate and seek feedback. Don't hesitate to collaborate with others and seek their opinions. Discussing clinical decisions with peers or mentors provide different perspectives and helps you, refine your thinking. You want to ask for feedback on your decisions and reasoning. Constructive criticism helps you grow as a critical thinker. Constructive criticism will help you grow. So you can't turn away every criticism. Criticism led my business where it is today. You got to take it, even if it's bad, Now, stay calm and objective. High pressure situations may cloud your judgment. Got to learn to stay calm, again, especially in a code. That is the most commonly, needed strategies for the NCLEX RN and NCLEX PN exam. So as you can see, it is still the bulk of it all is still content. We don't have the content, nothing else matters. So we got to get the content in and be ready to commit to this exam in a big way. Now, I'm going to quickly guide us on how to actually, I know you have the questions here for this question. So you have the content already. But I'm still going to go ahead and make this one my little simulation for how to actually read questions. So now, a 45-year-old patient is a keyword, was admitted for severe heart failure, keyword. The healthcare provider orders digoxin for the patient. Digoxin is a cardiac glycoside. Again, it's nice to know the drugs and class, but we are emphasizing it here. It is used in treatment for heart failure and atrial fibrillation. Which of the following lab result should the nurse assess before administering the medication? A, potassium level, B, calcium level, C, magnesium level, D, sodium level. Here we're saying it's a 45-year-old admitted. A 45-year-old is a keyword. The ability to understand and connect with your keyword is highly crucial. It is not a choice. You must see what your keyword is and what they are trying to get to. A 45-year-old is a keyword admitted for severe heart failure. A healthcare provider orders digoxin for the patient. Now, it is a cardiac glycoside, and this patient also have heart failure and AFib. What are you going to be worried about? Potassium, calcium, magnesium, and sodium. You strategize this without content. It's not possible, right? If you get this answer right, it's because you know it. And I'm seeing A in the chat right now, and that would be just perfectly right. A, final answer. So let's take a look at the rationale. Potassium level is important to assess for administering what? Digoxin, because hypokalemia increases the risk of digoxin toxicity. So we have to make sure that potassium level is good. Otherwise, we're going to be throwing the patient into toxicity. So, which can lead to what? Life-threatening situation or arrhythmias. Digoxin competes for potassium or with potassium for binding at the receptor site. So low potassium level will increase the drug's binding potential, enhancing its effect. Calcium level and magnesium level are important to monitor for other reasons. Calcium plays a role in muscle contraction and magnesium affects neuromuscular function, but potassium is the most directly related is the most directly related to digoxin toxicity. So sodium level is not directly linked. However, it can also play a role. So if you pick sodium, you are not all that wrong, but definitely potassium is the final answer. Let's take a look at the second question here. It's a 60-year-old male with who is prescribed what? Lisinopril, an angiotensin converting enzyme inhibitor, ACE inhibitor, For the management of hypertension, the nurse should monitor the patient for which of the following adverse effects: hypokalemia, hyperkalemia, bradycardia, hypoglycemia. What are we talking about? Patient is on lisinopril, an ACE inhibitor. Managing hypertension, what are you going to monitor for? Well, you know that ACE and ARB will cause hyperkalemia 100%. And we know the final answer is going to be hyperkalemia. Again, no strategy without content. This is based on content. If you feel like this is new to you, repetition will definitely get you there. Okay? At NP Certification Academy, we see you through, but you got to also do your part. ACE inhibitors are like lisinopril can increase potassium levels due to what? Due to their action on the renin-angiotensin-aldosterone system. This results in decreased aldosterone production, which normally promotes potassium excretion. Elevated potassium level can lead to serious cardiac arrhythmias. Hypokalemia is more commonly associated with diuretics like furosemide. Bradycardia is not typically the side effect of ACE inhibitors, although it can be seen with certain antihypertensive like beta blockers. Hypoglycemia is more common with medications like insulin or sulfonylureas, not ACE inhibitor. Okay, which makes sense anyway. You give anti-diabetic drug, you're probably going to get low blood sugar. You give antihypertensive drug, you're probably going to get low blood pressure. Sometimes we can just overtreat things and it leads to the adverse effect. There are more questions at the back of this content. Make sure you connect with it, please, okay? The slide is in Canvas. And now I'm going to shift on to what? Some more content for NCLEX RN and PN. Do we have any questions at this point? Dr. Kehinde Elisha speaking here, founder and CEO of FNP Certification Academy. To reach us, nurse-to-nursecoach@gmail.com or email nurse-to-nursecoach@gmail.com or visit www.mpcertificationacademy.com. Thank you so much and have a wonderful day. Don't forget to hit the subscribe button. Thank you.